Sculptra is one of the most popular treatments at the London Medical and Aesthetic Clinic, which has been performed for more than 20 years. As we age, we all develop lines and wrinkles, and we lose collagen from the skin, which mainly shows on the face. Also, the skin loses its elasticity, and the face in some cases could look sunken and tired. Naturally, the skin becomes dehydrated, which makes the lines and wrinkles more prominent. There are a few treatment options to restore collagen back into the skin and enhance our beauty, and Sculptra has proven to be the ultimate one. Quite often, patients ask Dr. Ayoubi, what is the difference between Sculptra and dermal fillers? The simple answer is, Sculptra is not a dermal filler. It is a unique collagen stimulator within the skin itself. Unlike traditional dermal fillers, Sculptra stimulates the body's own collagen, helping it to lift, firm, and smooth the skin gradually. Also, Sculptra is not a dermal filler. Nevertheless, it is the best treatment for natural-looking facial volumization. Sculptra can be used to achieve natural defined cheekbones, softened nasolabial folds, lateral facelifting, wrinkly chest, décolletage, wrinkly hands, and deep acne scarring. Sculptra is the best treatment to fill the hollow temple areas where dermal fillers should really not be used, as they might get lumpy and look odd. Furthermore, Dr. Ayoubi has developed his own technique using Sculptra to treat deep acne scars and different types of scarring with permanent results and without the need for aggressive surgery. With Sculptra, we can sculpt the face in a very natural way, and even more, we can treat facial asymmetry. This is where Sculptra really deserved its name. The results of Sculptra treatments are instant. Nevertheless, the results get better and better with time as the stimulation of collagen continues to work within the skin for 1 year, after which the results will be sustainable for about a year or so. Then the Sculptra will start to dissolve gradually and biodegradably, i.e. in a natural way. The Sculptra is made of lactic acid, which is a natural product which we produce in our muscles during exercise. Sculptra as a product has been used in medicine and surgery for over 50 years, such as in dissolvable stitches and soft tissue implants. Sculptra has a well-proven safety record and is an FDA-approved product. Sculptra works. Sculptra works by naturally stimulating the body to produce its own collagen. The final results are a much fuller and younger natural-looking face. Sculptra works very effectively on reducing the deep lines and wrinkles with natural-looking results lasting up to 2 to 4 years. The Sculptra must be injected deep into the skin, where it gradually begins to restore facial volume. With Sculptra, in most cases, the patients require 2 to 3 sessions, spaced around 2 to 3 weeks apart. Rare side effects of Sculptra. Patients should be familiar not only with the benefits and advantages of Sculptra, but also should be aware of the limitations, possible side effects, and complications before having any aesthetic treatment. And it is the duty of the doctor to minimize the risk of all possible side effects. Even so, they cannot be eliminated. The rare possible side effects of Sculptra treatment, like any other injectable treatment, a patient could have bruising, infection, skin discoloration, limited improvement, and lumps under the skin. Those side effects really shouldn't happen if the Sculptra is injected deep into the skin, and the treated area should be massaged very firmly for a good 5 minutes immediately after the injection. And the patient should carry on massaging the face twice a day, each time for 5 minutes for 5 days. Also, the Sculptra must be prepared in a specific way, 48 hours before the treatment. The treatment itself is slightly uncomfortable but not painful, as local anesthesia and ice should be applied before the treatment, which will help a great deal to minimize the discomfort and bruising. It goes without saying that a thorough consultation is essential to determine the patient's individual needs and whether Sculptra is the right treatment for their condition or not.